order to be helpful, in order to share information. So I already did create one video that it was regarding emergency line coronavirus questionnaire. Now I'm going to give you another questionnaire called screening or coronavirus screening. It have 1, 2, 3, 4, 5. I will give you 5 phases or 5 type of questions that the doctors ask their patients, okay? Before I start, thank you for liking, sharing, subscribing. You can check that other video pressing on the link above. Please like, share, subscribe, comment. If you like me to do a video for you, don't hesitate to write me a comment or a note. I'm going to do that for you. So the first part of the questionnaire, going to the point, I call that pre-screening or a medical history questionnaire. All the people that are suspected to have coronavirus, or everyone nowadays that goes to medical facilities, they are going to be asked these questions. And we start with medical history. But related to coronavirus, guys, they ask these questions to patients, maybe not the way I give it to you, but they ask them, I guarantee you that. So have you had any heart disease, like chronic medical condition, like heart disease, a high blood pressure, diabetes, lung disease, or OCDP, or chronic lung, all of these lung problems, fever, shortness of breath, difficulty breathing, pressure or heaviness in the chest area, dry cough, or any other medical condition that we did not mention here. So they will ask the patients. Number 2 type of question or questionnaire or screening is about traveling. Okay, have you traveled outside of the country in the past 14 days? Okay, have you traveled to infected or highly risk states, which is California and New York? There are few on the map, but if you have traveled in East or West Coast, especially in these red zones, okay? And have you been to the airport? Have you checked someone of the airport or anything related to traveling, going to the airport and all these kind of things? That's about the traveling. So the next series of questions, I call them exposure. So all of the patients, maybe some of them are asked 1 or 2 questions, maybe more, depend on their condition. Have you had a contact with someone that have coronavirus? Do you have or are you in the same household with someone who have the virus? Have you taken care of coronavirus patient? Have you been closer to 6 feet for at least 10 minutes with someone that have the virus? Have you had a direct contact with someone that have the virus but doesn't have no symptoms? This is very weird question, how you even know that, because if they don't have the symptoms, you cannot tell, but they still ask these questions. Have you been in the contact, if you have been in contact with someone at school or public area in the past 14 days that are suspected or have a positive test of coronavirus? Okay, there are 3 types of tests right now that they do here in America. Sample of sputum, nasal swab, and a throat swab, and they all go through the lab. Treatments, there is no treatment nowadays, but they give supportive care, pain medicine, cough syrup, rest and drink a lot of liquids. That's the recommendation. And then self-quarantine, what is that? This is to prevent a disease to spread, so-called home isolation. Stay at home, get out only for food and medicine. If you live with other people and you suspect to have some weird symptoms, stay in a separate room. Avoid contact with other people in your household. Avoid contact with people, doctors, assistants, anything in public, and pets. Cancel all non-urgent appointments with the doctor, and tell the doctors that you may suspect or you're suspected to have the virus. Wear a mask, wash your hands for at least 20 seconds, avoid touching eyes, nose, face with not clean hands. Do not share items, dishes, towels, any kind of utensils with anyone. And if you are having a severe shortness of breath or severe symptoms, call 911. Okay, guys, that was my coronavirus hospital questionnaire. That's the most common questions that the doctor are going to ask the patient to screen them to see if they eventually may have a coronavirus. Thank you for being here. I hope you like this video. Please share, like, subscribe, write me a comment, tell me what kind of videos you would like to see. Thank you for being here, and I hope you have a good day. Bye bye.